So I'm going to talk about Good Sam's implementation in Victoria, which over a similar time frame to what New Zealand had been running it. There was a bit of a competition there for a little while to see who would get it in first. I'm a little bit sad to say New Zealand pipped us to the post by not very much. So our call to action came back in 2016, and thanks to the fantastic work from Karen and her team, we were able to utilise the VACAR data. Looking at the chain of survival, we could see that 95% of the time, the initial call in cardiac arrest, people were correctly calling 000 and asking for ambulance. The call wasn't going to a GP or a neighbour. When the call came through to our call-taking centre, we don't run our call-taking centre in Victoria. We utilise, we have to utilise a statutory authority, the Emergency Services Telecommunications Authority, to do our call-taking and dispatch. But using the ProQA system, they can correctly identify its cardiac arrest 86% of the time, which, as we spoke earlier, is critically important for making sure that we're sending the right resources to the right patient in the right time frame. Bystander CPR occurring in 61% of cases, which is good. By international standards, it's good, but you can start to see there's starting to be some room for improvement there. Defibrillation prior to ambulance arrival. And this is fairly consistent, I think, with the data that you spoke about earlier, 4% of the time. When we think about the millions of dollars that governments have invested, philanthropic groups, that's a lot of Bunnings sausages sold to fundraise for defibrillators, and we're seeing them used 4% of the time prior to emergency service arrival. With that in mind, our time to defibrillation statewide is 9.2 minutes, which reflects fairly closely with our statewide response time, which sits at about 7.6 minutes. And 26% of the patients treated survived the event, so survived to hospital. The Utstein survival rate is a little bit better, 37%. Now that's the 2016-17 data. I have to say it's been fairly consistent in the 2017-18 as well. So there's a piece of work, and I think we've seen this slide already today, done by Charles Deacon. It's been around for a little while, but I do like how it really captures the impact that the early stages of the chain of survival can have on survival from out-of-hospital cardiac arrest. Really, the more we focus on the early recognition, the early call for help, and that early CPR, and those moments that are before emergency services can get there, the more impact we can see from survival from out-of-hospital cardiac arrest. So I'm just going to show you a brief little animation that outlines how Good Sam works in Victoria.
The Good Sam app is available in Victoria and integrated with Ambulance Victoria's dispatch system to quickly connect patients with help in the vital first minutes of a cardiac arrest. Every day, 16 Victorians suffer a cardiac arrest in the community, like Jack, who has suddenly collapsed at home and stopped breathing. His best chance of survival is if CPR is started immediately and a defibrillator is used as soon as possible. Time is critical as Jack's family call 000 for an ambulance. The call taker immediately dispatches emergency services and guides Jack's family to provide CPR while paramedics are on the way. At the same time, nearby Good Sam responders receive a phone alert that Jack needs help. Zoe, an off-duty lifesaver, and Max, a qualified first aider, both accept the alert. Good Sam directs them to Jack's location and where to find the nearest registered defibrillator. Zoe and Max arrive within minutes and perform life-saving CPR and defibrillation until emergency services arrive. Paramedics provide advanced care to stabilise Jack and then transport him to hospital. It takes a team to save a life, and Good Sam brings our community closer when someone needs urgent medical help.
One of the power of animations can communicate quite complex ideas very simply, and we use that in our recruitment for community responders. So part of setting it up, you obviously need to have a governance framework around it, and Bridget spoke about the AM PDS of Determiners that they utilise, and we went through a very similar process. We're looking for AM PDS determinants that have a high accuracy for cardiac arrest, so minimising that over triage. We wanted ones that have a high likelihood of attempted resuscitation by paramedics, so limiting exposure to the futile resuscitation attempts, palliative care, obviously to cease those types of patients. We obviously wanted to maximise the number of cardiac arrests captured by the program. It goes without saying that you really want to do that, but also minimising exposure to scene safety issues or highly traumatic and stressful events, recognising that any cardiac arrest is potentially highly traumatic or stressful. So where we landed with that is the 6 AMPDS determinants you see there, and collectively they represent about 80% of all cardiac arrests attended by AV in any given year. We also have a code of conduct which users agree to as part of the sign-up process on the app. And it's also, very much like New Zealand, automated and based on the AMPDS event type. And that automation really makes it very, very quick. So there's no intervention required from the call taker or dispatcher to activate the Good SAM system. It's purely driven off the AMPDS event type. And as I say, very, very quick. We can have multiple field reports of paramedics on shift getting alerted to the cardiac arrest by Good SAM 30 to 60 seconds before their pager goes off. So very, very quick, and also highlights an opportunity for improvement there with our rapid call taking and dispatch. We have a list of exclusion criteria, so we are constantly scanning the event chronology, looking for inappropriate locations. So again, places where we know there'd be an issue, we cross-reference with the location of interest database for nuisance, safety and violent locations of interest. We won't send good responders there. We also exclude out medical facilities, GP clinics, nursing homes, those locations. We do send people into private homes. The VACAR data tells us that 76% of cardiac arrest occurs in the home, so very much we want to be sending people to those locations. Inappropriate patients, and this revolves predominantly around our not-for-resuscitation palliative care type patients. If there's information to suggest that they're along that treatment trajectory, we won't send Good SAM responders to them. And then information around scene safety and occupational violence. So we're searching for about 2,000 words and phrases that suggest that there may be some sort of issue at the scene. Rendezvousing with police, ambulance are going to an RV, police have been sent, agitation, drugs, alcohol, mental health, all those types of considerations. We started with the introduction of Good SAM with a partnership model. So we had our own internal first responders. We have volunteer first responders, professional responders, paramedics and the like, APRA registered professionals, and also the partnership with the organisations you see on the screen. And it's a very powerful image of organisations that the community were quite adjusted to turning to in times of need. Some very iconic Australian organisations, if you think about the lifesavers standing on the beach. So that provided a good introduction of the app to our community, and we felt that it provided a good introduction to our workforce as well, because we needed to have a conversation with the workforce that we were actively going out, alerting these people and sending them to what were traditionally ambulance patients. But I'll talk about how we measure and improve in a second. In terms of the post-event care, it's been spoken a little bit, looking after our people, looking after those that are helping to look after us. So we undertake telephone-based follow-up with everyone that accepts a Good SAM alert, and that's one of our paramedic educators from the team will call. Firstly, thank you. These are people that are going out of their way to help within their communities. Any questions? And thirdly, are you okay? And if the answer to that question is no, then we'll refer them to ongoing support as well. And that's particularly important, we've found, as we've grown the responder base to include first aiders. Just in the last couple of weeks, we've had 2 people that have gone to falls from buildings, quite high falls from buildings and SIDS cases. And these are things that our professional workforce, our paramedics would find quite challenging, and we certainly see that in the first responders as well. The other thing we have there is insurance, so medical indemnity, personal accident injury and public liability. Not that we ever hope to need it, and it's in addition to the Good Samaritan provisions of the Wrongs Act that protects them. The other part is a connected health system, so the AED data retrieval, and again we've spoken about that, some of the work that's done with in Singapore, Yi was talking about. We attempt to get data off the AEDs that have been utilised, link it back into hospitals, because it can change the patient care trajectory through a hospital. And then importantly for the AED owner, we recommission the AED, so free set of pads, battery if you need it, make sure it gets back, and we leave the AED in the condition that we found it in. And we find that's it's a particularly good carrot for encouraging AED registration. People know that if they've registered their AED and we use it, we'll recommission it. Communication and engagement is absolutely critical when you talk about a community responder app like Good Sam. And you can have the best system in the world, but if you can't tell people about it, then what's the point? So we had a three-phased approach, and we started with that AED registration, so both direct engagement with communities through traditional media, social media, DFIB or groups that we knew tended to own DFIBs, sporting clubs, local councils and the like, but also critically engaging with AED manufacturers. So we now include AED registration information with 3 of the leading manufacturers for AEDs sold in Victoria, and we're constantly looking to grow that as well. We then had responder recruitment, so again, similar type platforms, traditional media, and through our social media, and then a public launch. And all of this was underpinned by patient stories. So survivors of cardiac arrest telling their story about how a community, how CPR, how defibrillation made a difference to them. And really, it's incredibly powerful having survivors stand up and tell their stories, because they can tell it in a way that we just can't as professional paramedics, and that numbers and statistics can't. If you look at the image in the middle there, Imogen was a 12-year-old who I often play her video, but I usually need a box of tissues up here. It's incredibly powerful hearing her tell her story. So in the mantra of measure and improve, we did an evaluation on the first 6 months of the program's implementation in Victoria, looking at a couple of key questions. Did Good Sam effectively integrate with AV's dispatch system? Did it meet its communications objectives and develop a community of first aiders that were willing to assist? Were we effective in mobilising first aiders and getting them to access the closest AED? And were there any issues that were highlighted? It's important to note in that first 6 months we were predominantly looking at an internal workforce, so our own first responders that work for AV, as well as our paramedic workforce. And the last month was when we opened it up to our partner agencies. So they're the key findings that came out. Did we manage to effectively integrate it? Yes, it's via a one-way feed. So we get the information out. We don't have information within our communication centre as to exactly what's going on in Good Sam at any particular time. We got some really good media coverage. 110 million was the total media reach. When you think about the population of Melbourne at 5.6-ish million, I think a couple of people got double counted, but that's all right. We grew our AED register, so another 600 AEDs on there, which is about a 17% increase. Close to 2,000 people signed up for the app. Almost half of our operational workforce, or half of our workforce signed up, which was fantastic. And an average time saving, so where responders did turn out, there was an average time saving of 1.7 minutes. So reasonably significant when we're talking about cardiac arrest, and importantly it also contributed to 20 lives saved, so 20 people that went home from hospital. So we generated 3,700 odd alerts during that period, and about 20% of the time, 15% of the time there was a responder within. We use a 400 metre alert radius in urban areas out to 5 kilometre in regional Victoria. They accepted the alert in about 16% of cases, but when you narrow that down to the number of responders that actually managed to attend, that comes down to about 5% of cases in which we'd notified someone. If you look at that as a percentage of all alerts generated, we're looking at about 1%. So there's clearly more work that could be done there. So what did we do? We held a press conference and expanded it, basically. Again, we used the patient stories. We got Dr. Krellin, who was a cardiac arrest survivor from Ballarat. He's an emergency physician that had a cardiac arrest about 4 o'clock in the morning, and Jess Handley, one of our paramedic educators, turned out, was described as an angel in pyjamas doing some CPR. And again, we got a really fantastic uptake from the media, and engaging also with the registered training organisations. So the people that are delivering CPR training, we're now engaging with them and having them include Good SAM messaging as part of their CPR training in Victoria. So that happened very early in July, and since then, so this is about 1 month's worth of data and internal unpublished statistics, but you can see already that we've doubled the percentage of, doubled the number of events where we get one or more responders notified. And already in the 1 month since expanding, we've had 63 responders attend to Priority Zero, which is our highest level of response events. If you compare that to what we were looking for over the 6 months of the evaluation period, we've just about equalled the number of events that we've attended in a 1 month period. So very, very excited to see how we can continue to grow the program with the engagement with RTOs in particular, and Karen and her team will be evaluating again in 12 months' time to see the impact it's had on patient survival. So our key lessons that we've learnt across the journey, the communication and engagement. As I say, you can have the best system in the world, but if nobody knows about it, then what's the point? And it really is a two-way conversation as well. You need to listen to what the community are telling you, address their concerns, and in a lot of cases the misconceptions around cardiac arrest as well. So it's certainly not a one-way street. Support those that are supporting you. These are by and large ordinary people, and we're placing them in what for them are extraordinary situations. The mental health and the support around that is absolutely critical, and I think increasingly we will be judged by the support that we can provide people when we put them in these situations. And as we've said all day, measure, improve, measure, improve. So where does the future lie? And we had some of this discussion with the last session, but to echo on some of those points, AEDs, are they located in the right place? And that's a question again that we'll look at through VACA, and we've got a PhD student at the moment looking at that as well. The next game changer, I think, in that space too will be accessibility to AEDs. So currently we have AEDs costing $2,000 or $3,000 a piece. I know there's technology that you're looking to come to market later this year, which will bring the price point to that down to about $150 or $200, which will be an absolute game changer in terms of accessibility to AEDs and really open up, I think, the opportunity of having these in private residences in people's houses, which will just be a fantastic thing. The innovative AED delivery solutions, whether that's a drone, whether it's taxis, whether it's Domino's pizzas, you can get a pizza to just about anywhere in Melbourne in 6 minutes. Why can't we do the same with a defibrillator? And absolutely the link with our communication centre there as well. When you call for 000, you should absolutely be able to be told where your closest AED is. If there's multiple rescuers on scene, send someone to go and get it. And the video streaming is something else there, and I notice again in Singapore we seem to be doing a lot of following after Singapore here. The video streaming back to the communication centre, and we're currently doing a piece of work to use that in our secondary triage as well, in mental health assessment, which we think could be particularly good as well. So I'll close out there, but just with a short case study. A case that's happened in the last month that I think really epitomises what's possible through the chain of survival, and I'll preempt the ending by saying that it's actually not a good outcome, but the chain of survival really came to play here, where we had an 18-month-old, so a very young child that was found in cardiac arrest by their parents one evening, and from the moment they picked up the phone, you can imagine a very heartfelt call to 000. Cardiac arrest was very rapidly identified, and from the moment that call started to the moment we had a first responder, a Good SAM responder on their doorstep, was a period of 90 seconds. 2.5 minutes after that, the fire truck turned up, and 2 minutes behind them was the first responding ambulance. As I said, the outcome was not good, but even in those circumstances, if there was ever going to be any chance for the parents to know that everything that could possibly have been done was done for that child, and also for if you consider from the moment where that call for help has originated, to have help there in under 90 seconds, I think is just a fantastic achievement, and really epitomises the possibility of what you can do when you crowdsource and tap into the community. Thank you.